Natural Alzheimer's treatments that work without the use of medicine. Dementia is classified into three forms: Alzheimer's disease, vascular dementia, and Lewy body dementia. All three varieties of dementia include symptoms and treatment options that are comparable to one another. The search for a dementia cure continues, but natural treatments and lifestyle changes have shown promise in terms of delaying the progression of the disease and enhancing the quality of life for those who are suffering from the condition. According to researchers, nutrition is the first and most important natural Alzheimer's treatment since it is the most effective. Several recent studies, as well as centuries old wisdom from throughout the world, have demonstrated that various nutritional components can be beneficial to those suffering from memory impairment and dementia. Modifying your daily vitamin regime in tiny ways can help alleviate specific signs and symptoms of dementia. But making large dietary adjustments, such as eliminating white sugar from your diet, can assist in alleviating more severe signs and symptoms of the condition. Even though the success of nutrition therapy varies from individual to individual, it is quite likely that you will see some benefit if you follow the instructions provided. Supplements. It has been suggested that dietary DHA supplements may be effective in slowing the progression of Alzheimer's symptoms. In addition to eggs, fish, organ meats, and algae, DHA can be found in a range of other foods including fish oil, flaxseed, and walnuts. This chemical, which may be found mostly in fish oil, is on the list of natural Alzheimer's treatments since it has been shown to slow down cognitive decline in people with Alzheimer's disease. High doses of the antioxidant vitamin E can be harmful when used in conjunction with other Alzheimer's treatments, according to medical specialists. Almonds, seeds, broccoli, and other greens, as well as fruits such as mangoes and blueberries, are examples of foods that are high in vitamin E content. Vitamin E can also be obtained from exposure to sunlight. It's worth asking your doctor to run a nutritional panel on you, as eating a diet high in these foods can often result in higher vitamin E levels. These will allow him to determine whether you might benefit from taking additional vitamin E or other supplements. Turmeric and other members of the ginger family of plants, which have traditionally been used to alleviate the symptoms of aging, such as inflammation and oxidation of cells, have recently shown promise in alleviating the symptoms of dementia, such as memory loss and the ability to concentrate, as well as the pain and swelling associated with arthritis. We urge that you contact your doctor before beginning any new herbal regime because this plant has been demonstrated to be potentially dangerous for persons suffering from gallstones, jaundice, and those taking blood thinners. Modifications to one's diet. People with a high BMI combined with a predisposition to build fat around the waist are 2.5 times more likely to be diagnosed with Alzheimer's disease than people with a normal BMI but no predisposition to accumulate fat around their waist. People prefer to consume high amounts of sugar, which is one of the components that has been linked to obesity and that they tend to consume in large numbers. Obesity, diabetes, and Alzheimer's disease are all clearly and unmistakably linked in a plain and ambiguous way. The fact that sugar is able to cross through the blood brain barrier has serious ramifications for the health of the brain, as it causes the degeneration of synaptic networks, which are essential for our ability to think clearly and effectively. How baking soda affects people with type 2 diabetes. Diabetes has been identified as a risk factor for the development of Alzheimer's disease in part because of this, as well as other symptoms such as the tendency for people with diabetes to be overweight. The guide includes a 2-week grocery shopping list to make preparing meals for the plan straightforward. Changing to a Mediterranean diet, which includes whole grains, fish, nuts, fruits, vegetables, and healthy oils, has been shown to be the most effective strategy for preventing obesity, diabetes, and dementia. Switching to a Mediterranean diet is specially recommended for people who have diabetes or who are at risk of developing diabetes. Cognitive decline has been shown to be slowed or even prevented entirely when this diet is paired with frequent physical activity. According to promising data, having a nutritious diet and remaining physically and intellectually fit can assist to avoid the progression of Alzheimer's symptoms, while also giving a variety of additional benefits outside of improved memory. Exercise is the second most effective natural Alzheimer's treatment method. Dementia care for senior citizens in India. A vast amount of study has been done on the relationship between physical activity and dementia. Increasing physical exercise among all older people by just 25%, it is predicted might avert up to 1 million cases of dementia around the world in the next 20 years. Specifically, workouts can be effective in the management of vascular dementia, which occurs when brain cells die as a result of blood flow being interrupted somewhere along the routes as a result of plaque buildup. According to the findings of several research, regular exercise is a great approach for reducing plaque buildup and for preserving muscle mass in the body. Recent research has shown that 150 minutes of aerobic exercise per week is advantageous for people over the age of 65 in terms of cognitive health. If you don't want to go to the gym, there are a variety of other possibilities for completing your 150 minutes of exercise in at your convenience. Look no further than our list of the best 25 movies and exercise equipment for remaining healthy and home if you are searching for some motivation. There are numerous strategies for raising your heart rate at home without ever taking up a dumbbell. All you have to do is incorporate your lifelong interest into your aerobic workout. Physical activities such as gardening, walking about the neighborhood, performing yard work, and dancing are all fantastic ways to keep elderly adults healthy and physically active. Social interaction is the third natural therapeutic option for Alzheimer's disease. When it comes to improving cognition and overall well being in those suffering from Alzheimer's disease and related dementias, psychosocial therapies are a terrific treatment option to consider. Whether your loved one is aging in place with your assistance or is in an assisted living facility, research has shown that ensuring continuous social interaction while focusing on what brings individuals joy can improve the lives of those suffering from Alzheimer's disease and other forms of dementia, according to the American Academy of Neurology. Participation in social activities is one of several ways that can be used to improve the overall quality of life and, in some cases, the symptoms of dementia. A wide range of opportunities exist for residents of nursing homes and assisted living institutions to improve their overall quality of life through social interactions. Participants' mood improved nearly immediately after participating in group activities that involved remembering, according to research. People with dementia and their caregivers have experienced a number of mental benefits from sharing memories in a relaxed situation with them. These benefits include increased satisfaction on both sides of the caregiver patient relationship. After their cognition begins to degrade, persons with Alzheimer's disease can learn new methods to engage with their caregivers. These could be accomplished through participation in a variety of sensory activities. Drumming is a low impact physical activity that allows patients to experience a sensory rich environment while they are being treated. Art activities such as pottery, whether done in a group setting or as an individual project, can help to engage the mind and slow the progression of Alzheimer's disease by stimulating the senses. When used in conjunction with other Alzheimer's treatments, art activities such as pottery can help to engage the mind and slow the progression of the disease by simulating the senses. It is possible that this form of activity will be beneficial to those who are beginning to experience communication issues, since it will provide an alternative outlet to speech, which will eventually become difficult in people with advanced dementia. In adult daycare facilities, which are sometimes known as day programs, a group of older adults, typically with varying degrees of dementia, are cared for under the supervision of a caregiver. A full day or half day program is often offered, and it includes all of the tools and equipment necessary to care for the elderly while also providing them with some from the recreational activity. According to the findings of the research into these programs, they are useful for both caregivers and those suffering from dementia, as well as for those who live in nursing homes or assisted living facilities. Rest is an important part of any natural Alzheimer's treatment plan. According to recent study, there is a significant association between cognition and sleep patterns. Healthy adults who lose even one third of an usual night's worth of sleep can suffer from significant short term memory loss, which is similar to the cognitive impairment seen in Alzheimer's disease, according to study on sleep deprivation. Disrupted sleep can have much more severe consequences for those who have been diagnosed with Alzheimer's disease and related dementias, and it can worsen the symptoms of normal dementia. The prevalent side effect of dementia is sleep deprivation, and as a result, this condition may be quite challenging for both the senior with dementia and the person caring for them. It has been established that cognitive behavioral therapy (CBT) is beneficial in treating the symptoms of insomnia as well as depression in older persons, with the primary advantage of therapy being the instruction in healthy sleeping patterns. The use of cognitive behavioral therapy (CBT) is effective for both the elderly and their caregivers in the treatment of stress and insomnia. Additionally to medicine, bright light treatment (BLT) is a good way for assisting in the regulation of our circadian rhythms or sleep cycles as we mature. In order to encourage the body to establish a healthy circadian rhythm, individuals suffering from insomnia are encouraged to look at bright lights at specific periods of the day. As an added benefit to sleep, regular aerobic exercise has been shown to be one of the most effective ways for automatically regulating sleep patterns according to scientific evidence. Medical treatments for Alzheimer's disease that are non invasive in nature. In your mind's eye, acupuncture is probably associated with thin needles being placed into the body at specific medians to aid in a range of health advantages, such as increased cognition in dementia sufferers or immediate and long lasting pain relief. It has been used as a medicinal treatment for millennia all across the world, and modern science has proved its usefulness through the use of magnetic resonance imaging (MRI). Researchers have recently discovered that not only is acupuncture an effective treatment option for improving cognitive abilities, but that participants in the studies also reported improvements in other areas such as pain and insomnia. Both reflexology and gentle massage, whether used to relieve pain or enhance mood in people living with dementia, have been demonstrated to be effective strategies to improve the quality of life and increase mood of people living with dementia. Massage has been found in nursing home trials to be effective in alleviating pain and reducing suffering in patients suffering from Alzheimer's. Unfortunately, there is no cure for Alzheimer's disease that is 100% successful. Natural Alzheimer's treatments, on the other hand, that can halt the progression of the illness are welcome news for patients and their caregivers. And they can also help patients maintain a healthy body and mind in the long term. During your personal or professional experience with Alzheimer's disease, have you found any of these therapies to be beneficial? If so, what therapies have you found to be most beneficial?